If you stop Librela and the symptom is still there, it is not Librela. Okay.
I went to just give her a little pat on the shoulder, and then she hugged me, and I'm like, you're so strong. I tried to let her know.
Dispensing trazodone for everybody.
Allie had literally, I'm not even kidding you, this size metal spatula, and it was just lubed up.
I think that the media and social media and media in general have just spun it out of control. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. All right.
Wow.
Hammer. Get that hammer. I can't get it.
You're closest. No, you have to hit the board.
Oh, ain't nobody gonna hear it because our microphones.
Okay.
She hit the hammer if you couldn't
Hammering
see.
home our reviews.
Baby.
Wow, it's almost like you're just there.
Damn, we haven't moved. Darn it. 309 on Spotify, 119 on Apple.
Thank you.
Pretty
Same.
darn fantastic.
We agreed,
Thank you, everybody.
Duck wasn't here to share the news, but we agreed that at 310 we're skydiving.
We did not.
Once again, nobody is stopping you from skydiving.
I agree.
We will be there for you.
We will be on the ground
but
waiting for you.
us four are not you are skydiving. We will be there.
I'll have a picture of you.
I'll go up in the plane and watch you jump out, but I'm not jumping
I will
out.
land
What
on
if
the
I
ground
grab you
in the
with me?
plane.
No, that'd be very bad because you're not skilled to carry me with you.
That? What if I grabbed you? All right, anyway.
Jeez. Okay. Social channels are killing it.
Mm-hmm.
Instagram and TikTok.
At
the Veterinary Roundtable.
Mm-hmm.
That's all I'm going to do.
Oh, sure. Okay. Our YouTube, if you would like to watch us instead of just listen to us, our video podcasts are published there at the Veterinary Roundtable. And you can also watch video forms of this podcast on Spotify now, which is pretty cool.
Yep.
That's new.
It's amazing.
Mm-hmm.
You can see us. If you haven't already, go back and watch our series of podcast episodes revolving around Proposition 129. We did an episode with Dr. Steele, Mark Cushing, Dr. McCormick, and Dr. Sue Vandewood. It's definitely the best place to find insider information on the situation as it's unfolding.
Woo, woo.
Woo, woo, woo.
Big news.
Big news.
We
Holy cannolis.
we sold out a little bit ago, but we sold out of our live show, which is insane at VMX.
350 people.
365. Woo!
That's new to me.
I need a handshake. Have you guys seen the
just blocking.
Have you seen the one?
That's definitely how it goes.
Lindsay Lohan that did what's the name of the show she did?
Gossip Girl? I don't know.
Oh,
help me out.
I know what you're
Courtney.
talking about.
Do you know what I'm talking
it's
about?
not going to come to me.
She has a handshake with the guy, and she's like, ding, ding,
Yeah, we'll
ding,
get on
ding,
that.
ding, ding.
Maybe during
Can
the
we-
live show.
Can we develop one so we
Yeah.
have one for the live show?
Yes, we can get on that.
Okay.
In the airport.
Okay.
On the plane.
Okay, that sounds good. I love it. I can't believe
You're
it.
gonna
sold out.
have
360
You're gonna have
65.
some good content from us.
Yeah, you are. Yeah, that's another reason to follow our social media because our content is going to be insane.
And come find us.
Oh yeah, come find us. So
will
we'll
be
be at
easy
the
to-
conference
easy to
Saturday and
find.
Sunday.
Yeah.
And potentially Monday.
Yeah, so
Maybe.
please find
But we
us.
should be in the conference hall, and at some point we will be in our red scrubs. So it'll be
Stop
pretty
us.
hard to miss 4 ladies in red.
We need to set a goal for the number of pictures we take with people. I'm going to say,
okay.
I don't know how many. I don't even have a guess.
105. Oh.
If we could take a picture of everybody at the live show, and we'd have almost 400 pictures.
Okay, we definitely need to do that where
Like
we
a
turn
selfie.
around
You know, you should.
and take.
Yes, we need to do that. Yeah.
Okay,
or
we gotta
you
do that
go
for
around
sure.
to the
For sure.
tables. And
Yes,
For
okay.
sure, for sure.
yes. Okay.
All right,
We'll
very
do
cool.
that. We are giving away a handful of tickets during VMX. Another reason to come find us in the exhibit hall because you might get a little something.
That's
and you might
right.
be able to come see us, even though
little
they're sold
something.
out. We have.
I mean, we've had a lot of people being like, open up the tickets. And we're like, we can't. We
So-
literally, ORED only has that number.
yeah.
We pushed them to 365. They won't let us do more than
Yeah.
that.
But we may have a little trick up our sleeve while
What's
we're
the
at
trick?
the conference hall. We may have some tickets in
Oh,
our pocket.
yes. That are,
if
yes.
you come find us.
Yeah. So,
So
for
wink,
sure.
wink.
Stay tuned.
Okay.
Okay.
I'm Dr.
Well, we
Emily
will see
King.
you all there.
I'm Devin Fortune.
And I'm Courtney Allen. And we are missing Dr. Ashlyn Duckwell.
And with her, we are the Veterinary Roundtable. Without her,
We
we're
are the-
the triangle.
The veterinary triangle.
We're not a square. We're
The
a triangle.
Veterinary Triangle. That doesn't sound bad. I think that's what we should call ourselves when
This is
someone's
definitely
missing.
an obtuse
Okay.
triangle.
Obtuse?
No, boing, boing, boing.
We can make it more.
It's a triangle.
Okay.
It's an obtuse
There's 3
triangle.
points.
It's 3 points triangle. Okay.
Yeah, but
I
it's
like
an
it.
obtuse triangle.
Okay, sure, Devin.
Did you guys go through
Obtuse.
geometry?
No.
Yes, no, and I
There's
absolutely needed a tutor
isosceles,
during.
equilateral. I would not have remembered that if I
90-degree
weren't
triangle.
sitting here talking on a podcast. It all just came back to me.
Right angle triangle. Okay. Okay.
Anyway, there's your lesson of the day. All right, pits and peaks. I'll go first. My pit was gonna be
Yeah.
the cold.
Oh, okay.
It's just if it's gonna be this cold, it needs to snow. That's you won't change my mind.
Still there.
There's no point of it being this cold. My peak is obviously VMX because we leave this week. When you are listening to this, we will be on a plane to Orlando.
Yes,
That's
we will.
insane. And that's stressful because I haven't packed a lick of clothing.
I don't.
I'm
yeah,
totally
it doesn't stress
unprepared.
me out. I packed the day.
I normally
before.
pack like weeks in advance.
Yeah, you should probably get on that.
I've been busy.
Your day off tomorrow. It's okay.
Yeah.
Yeah, you'll get
I'll
there.
get it done.
Anyway, my peak is the VMX. I'm really excited for all of that and the fact that my husband gets to come. I'm really excited.
That's fun.
Mm-hmm.
So he'll get to see us. He'll be at the show, and then it's kind of like a little vacation for us, just get out of
Yeah.
Indiana.
Yeah, for sure.
So I'm very excited.
Well, it's obviously my peak as well. I'm also excited for the carpool in the morning because I'm picking up her and Duckwell, and it's like 5 a.m.
I'm
so
not a
it's
morning
gonna
person,
be
so do not talk to
interesting.
me. I'm not going to be in a good mood.
I'll pack snacks. I'll make you guys breakfast.
I don't.
So you're driving everybody.
Yeah.
Okay, that's excellent.
I'm not a morning person.
I'm gonna swing by, pick her up, swing by, pick Duckwell up, and
Meet you guys at Southwest.
still be dark.
Southwest terminals, or baggage check, or
we're gonna
Or
be
the plane.
we're gonna
or
be so
security
annoying
check,
on the
or the
plane.
gate.
Are we?
Or
We have got to all
passen-
sit together. If we don't, we're going to be yelling at each other down the aisles.
Listen, Southwest is really great that way. We just need to be in the same boarding time frame,
The
and then you
passengers
pick
are gonna
whatever
hate
seat you
us
want.
because we're all gonna be screaming and laughing.
I don't know.
and-
We might all be sleeping, to be completely honest.
I
think-
really wish we had some of the roundtable merch to wear on the plane.
That's what I wanted. That was my plan. That was going to be my airport outfit.
I really
and then
wanted
I
to
come
be able to
find
wear
out
that. Like
we don't get him to
town.
Orlando.
Uh-huh.
Be like,
Darn it.
you see this?
Yeah.
I don't think we have anything other than this that we can wear. Do we?
No,
I'm
we
not
don't.
wearing my scrubs on the plane.
No, we don't. We
No.
don't. We don't have anything else.
We have nothing.
What if we had? Oh my god! What if we had a red sweatsuit? Like a no,
I love that idea. Red tracksuit.
like a hoodie and sweatpants.
Can't we
that
all
were
walk
bright
through
red
the Indianapolis
with our
airport
logo?
in red?
It'd
People
be
look at us
so
like we're
I want to do a
crazy.
music video to
cute.
that, like us, just walking down the
If
hall.
you can
We look
order
like
us
we're
all
from-
sweatsuits before Friday, I will wear it.
We don't have any official merch yet.
No, we don't have any official merch
Yet.
yet. Wink, wink.
Yet.
Even if we all just wear like red hoodies.
Okay, we can go to Hobby Lobby.
I was gonna say get the $40 Gildan hoodies.
Yeah.
I'll wear whatever you guys put on me. I'm
I don't know
in.
if I have any red.
I don't have any. I have a State
red. I
Farm
have red.
sweatshirt.
I have red leggings.
Yeah, I have a State Farm sweatshirt in this. This is the only red
State
I own.
Farm.
Yeah, because Jacob won his Jake from State Farm one year,
Mhm.
and our friend gave us the sweatshirt. Anyway,
Mhm.
okay.
So yeah. My pit, I guess, not to be like a Debbie Downer, but last night I had a sad situation. We had a cat come in for just like a possible UTI. We haven't seen the cat in a while. I think last time we saw it was last fall for a possible UTI. So we got a urine sample with ultrasound guidance. The bladder looked fine, but the urine was very dilute. It was like a 10-year-old cat. So we told the owner like probable kidney disease, like we'd recommend blood work as the next step. But the owner has a old Samoyed that is a diabetic, and we see her once a month for glucose curves because she's really unregulated. So just like financially, she wasn't in a position to work up that situation and manage possible kidney disease or whatever is going on with the cat. And they did opt to euthanize, actually. So we euthanized this kitty. And the second half of the sad situation is that the owner is so sweet, but she has a son with Down syndrome, and she didn't want to be present to not confuse him. So it was just a different barrier.
Yeah.
Like she was trying to be so strong for him, and she was like trying to hide her tears, and he was like, "Oh, I don't want to leave without Bella." And then he gave me a fist bump, and they just left and went about their day. And it
Yeah.
was just
That's tough.
It's different.
That's very
That
tough.
is a hard situation for sure.
Yeah.
Yeah.
But that's my pit.
Yeah. That's a hard one.
Mhm.
But she was being so strong.
Navigating being a mom.
I know.
Being a mom is hard in general.
Yeah.
Moms are superhuman, superheroes.
Superwoman.
I like went to like just give her a little pat on the shoulder, and then she hugged me, and I'm like, "You're so strong." Like I tried to let her know, but she just kept saying like, "No, Devin or Bella's gonna stay with Devin. Devin's gonna take care of her." It's like, yeah, Bella and I are just gonna hang out. But I don't know.
Oh, well, I'm glad you were able to help them
Yes.
and make them feel better. And yeah, my pit is I don't know.
Have you packed?
What'd you say?
Have you packed?
I've not packed.
I literally, when we go to
My
Hilton Head,
pit
I
is
pack the day
figuring
of.
out to get everybody organized.
Which
Yeah.
button down you're gonna wear?
Which button down I'm gonna wear.
That's,
and
yeah.
and I got to make sure all the other people coming
Yep.
with me, because we turned this into something more
Family
than it
event.
needed to be. Some
family
event.
affair.
And then and so like making sure everybody's organized, making sure we got everything we need to get
Yeah.
there.
Yeah.
And I
Who's
was in charge of
watching
getting all the stuff
the
for
dog?
them to do their stuff. What?
Who's watching Kaya?
Trevor is staying back.
Gotcha.
He doesn't like the rides and stuff like that.
Sure.
And so he was like, I'll go to Florida with you on another time. So then we're going at a different time. So
Mhm.
that worked out well.
Didn't you guys recently go? You and Trevor? You recently went somewhere.
Yeah, we do that. Well, we'll go, like he and I will go see my mom. So
That's sweet.
it's kind of like his thing to do.
Yeah.
Last time we went to Universal with Trevor, we would go
Uh-oh.
on the ride, and right before we get on the ride and he said he'd want to go, he'd be on the ride at the very beginning and say, "Hey, is it over yet?"
Yeah. What did we do? Talk him into going on the Harry Potter ride?
We
And
talked him into going on the Harry Potter ride.
It's
and
literally
we-
5 feet off the ground. And I was
So
like,
my kind of ride.
yeah, I was like, Trevor, take your glasses off. It's not scary. He's like, I can't do it. I can't do it. I can't do it. So he and Calvin screamed their entire way through Harry Potter ride. It
Oh
was,
goodness.
Yeah.
That's
So
gonna be me if you
yeah.
take me on any roller coaster.
yeah, it was
And
hilarious.
then afterwards, he's like, "Actually, I think I'm okay. I don't like it."
Right. Yeah. Yeah. So he ended up
Oh
just
my
waiting for
gosh.
us at the rides
That's
a lot of the time.
That's funny.
So my peak is VMX. I mean,
Yeah.
of course. I
Duh.
It's
It's
so
also-
much fun. I'm
yeah.
so excited for you guys to be able to go and for you to be able to experience meeting everybody and just interacting and networking and seeing the exhibit halls, which are just amazing at these big shows, and just all of it.
Mm-hmm.
It's a whirlwind, but it's a lot of fun.
Mm-hmm.
So
It's gonna be a lot, but it's so worth it.
yeah, for sure.
For sure.
Okay.
All right, trending topics. We are going to
Woohoo.
tackle the Dear Veterinarian letter about Librela.
Oh dear, this is a can of worms. It's a large
Dear
one.
Veterinarian.
All right.
Okay, so you said you read it.
I did.
Should we pull it up?
I mean, it's not a big article by any means.
Okay.
It's just
One page.
As long as I pulled up the right one.
Yeah.
But it just goes over the fact that the side effects, or I guess, yeah, the side effects we're seeing from Librela can include ataxia, neurologic changes, and a whole other plethora of things, but those are the big ones. But if there are side effects reported, the DVM needs to report it to the FDA, and then they have an entire agency that looks into the side effect that, or the adverse reaction that is seen, and take it into account. But it's, I mean, the drug has been tested vigorously.
Yeah.
It
and-
also should be noted that
And very
most of the
in-depth.
time this drug is used in older patients.
yes, but that's part of the problem, right? The veterinarians are their own worst enemy. So
Yep.
in the United States, they launched this drug and everyone was in such desperate need of it that we thought of it only for our train wrecks.
Mm-hmm.
So we're like, oh, this dog, now we don't have to euthanize this dog. So
I
we're
see. So it like makes the statistic a little bit harder.
Well, it's just that we're using it in such older patients that the likelihood of them having comorbidities is higher.
Yeah.
If you look in Europe, they're using it in mild and moderate cases, and they're have far less. Like there's
I
no
see.
shenanigans going on in the media.
It's not last
and
ditch
the-
effort.
But, like
yeah,
here we
it's-
pretty much only have data for like older.
No, not that. It's just that I think that the media and social media and media in general have just
Sure.
spun it out of
Mhm.
control. I think what the FDA letters show you is that the FDA, these Dear Veterinarian letters, regardless of the product, when they come out, they show you that the FDA is doing their job.
They're doing
So-
as much as they can.
Yeah, there's post-market work that gets done on
Mhm.
products. And so the FDA's job is to investigate, to your point, every adverse event that gets reported.
Mhm.
There's an entire group of people that work through these things and then form a consensus as far as why did that happen to that dog.
Mhm.
So any of the adverse events that have been reported, they mentioned also in this letter that are still, they are all considered rare, whether it be PUPD,
Yep.
ataxia, dementia. They're all still in the rare category, which is 1 to 10,000 cases.
Mm-hmm.
So for every one case for every 10 doses given
Mm-hmm.
is an adverse event. So something that wouldn't normally happen to your dog happened.
Right.
That's an adverse
Mhm.
event.
I see.
So I think there's just so much clickbait right now out
Mhm.
there, like in
Agreed.
drama cells, right? So you're just getting all of this like madness going on. The drug has been used and has been given, I think what the last time I looked, it's like 20 million doses with an incident rate of 0.19%.
That's crazy.
Do you want to know what the incident rate is for vaccines?
No.
No, you don't. The other thing I don't think people understand when it comes, and I'm going to get on my soapbox about this drug
That's okay.
because I'm in love with this drug, but I think it's a monoclonal antibody therapy.
Right.
The only drugs being pushed out right now in human medicine are monoclonal antibodies. Why is that the case? Why are only monoclonals coming to the market?
Mhm.
Because they're safer and they're more efficacious. So that means they work better and they're safer. Why are they safer? Why do they work better? Because they only do one thing. And it depends on what the monoclonal is, that it's what it's supposed to. But for Librela, it does one thing. It's
Targets
lowering
muscle.
nerve growth factor. It's lowering nerve growth factor to a normal level. That's all it does. It does not do anything else. It cannot cause disease.
Right.
So if you think that your dog has had a side effect of Librela, an adverse event for Librela, it would look like this. You give Librela, 24, 48, 72 hours later, your dog is doing something weird. At day 14, it wanes, so it improves. By day 30, that side effect or adverse event is gone. If you stop Librela and the symptom is still there, it is not Librela.
Right.
There is something else going on with your
Right.
dog.
Yeah.
And we don't do your dog any favor by blaming the drug.
Mm-hmm.
You need to go through and you need to do diagnostics and you need to find out why is your dog continuing to have that symptom.
Yep.
It is not Librela. Librela is not causing osteosarcoma. It doesn't have the ability to do so.
Yeah.
It has one function and one function only.
Mm-hmm.
So people talk a lot about like causation and correlation, and it was explained to me one time this way, like, you put deodorant on in the morning and you have a cough in the afternoon. There's correlation. You put deodorant on, you have a cough. Your deodorant did not cause you to cough.
Yeah.
Same thing with Librela.
Yeah.
So there's correlation, but not causation. And
That's a
I think
good way to
people
put
get
it.
wrapped
Yeah.
up in,
Well, and social
Thinking
media
that.
literally spirals everything.
Oh my gosh, yeah.
Like
I hate it.
spirals within like 10 minutes.
I mean, it's sent this, and it's happened to every new drug. It happened to Simparica. It happened to Apoquil. It happened to
It's going to happen to anything. If you
Yeah.
give your dog something new, like that's just what's going to happen.
any new
But
drug. Any
you
new
also,
drug.
before you start opening your mouth, you do your research.
Mm-hmm.
Yeah.
And then there wouldn't be this many problems.
Well, and I think, if you don't know whether Librela is right or not, like talk to your veterinarian.
Right.
Obviously, there's definitely a risk-benefit conversation that should happen,
Yep.
especially if you're talking about older patients.
Yes.
Because,
And if it's your like last ditch effort, like how we sometimes do use it,
Yeah.
because the dog, I mean, we also recently got it. So like we have those kiddos who have been on Galliprant, gabapentin, whatever, like everything. You're like, yeah, let's just throw this at them. Like,
Yeah.
there's also those.
and I looked at our doses given, and then I called our rep to see how many adverse events have been reported. We've given 2,000
From us?
doses. Yes, from
Okay.
All-Star. 2,000 doses, 2 adverse events, 1 PU, PD, which resolved and the patient's still on it, and 1 ataxia that resolved and the patient's still on it.
That's
So
awesome.
even with those, they still kept
That's
giving
so
it.
cool. That's
If
good
you've
to
been
have that
giving your
information.
dog Librela for 6 months and now you've seen this on social media and you're like, oh,
My dog's dying all of a sudden.
what am I going to do? Nothing.
If your dog is
because your
okay.
dog has been fine for 6 months.
Yeah.
Mm-hmm.
It would have already had an issue.
Yeah, right.
Mm-hmm.
If your dog is showing up with something, again, it's not. Stop the Librela. And if in day 30, and I have to double check like exactly what day it's out of their system, but day 30, if that symptom is still around, it's not Librela. It's
Mhm.
something else.
Mm-hmm.
And so you better go do the digging. Go find out why.
Yep.
So anyway,
Yeah.
it's I get frustrated because I can't imagine not having the tool available for patients.
Mm-hmm.
Because the other thing that's really interesting is that people are like, oh, just use an NSAID. Well, one, you have to remember to give the NSAID. And two, there's a study that shows the adverse event events with NSAIDs, and they did this with actually meloxicam, it's 3 times higher than with
I don't
Librela.
doubt that.
3
Only for
times higher
meloxicam?
than with Librela.
That's an
When given
anti-inflammatory
daily. So
going,
they gave it daily because that's what you do with Librela, right? You give it, it's a once a month monoclonal antibody injection. You give it, it stays in their system. So to pair it, they gave meloxicam daily for however many days
Can't
of the
even
study.
imagine having to do, like, let alone doing that, but then the body has to filter that out.
Yeah.
The liver
Yeah.
and kidneys have to filter it out.
Yeah.
Yeah.
And that's what's
Seems
getting
like it'd
injured
be
in the
more
process.
more
but they
strenuous
don't. The
than
liver and
the-
kidneys don't necessarily process the like.
Mm-hmm.
You know.
Yeah. So I think, at our clinic, if we have older dogs we're using it on, we do have those conversations with folks. We do want to try and control all these other diseases going on before we start a new medication.
Sure.
Mm-hmm.
But I am not absolutely not afraid to use Librela.
Mm-hmm.
Hands down. We use Silencia like it's
Yeah.
Candy.
candy. And we were talking about this before the podcast that it's the same drug.
Nobody attacks Silencia.
It's because it's cats.
That's true.
Cats
No one
get
messes with
ignored.
cats.
Cats live forever, and cats are silent stuff first.
Yeah, I know.
You don't know they're dead until they are.
What have you
They're
guys
sick until they're dead.
What have you guys seen with Librela? I've like talking to clients and whatnot with all the stuff going on. Have you seen anything
I haven't
weird?
gotten much pushback recently. I did like several months ago when I
Mhm.
feel like this all started,
Mm-hmm.
but it might have been like a one-time situation.
I personally haven't experienced any clients talking to me, like asking about all the social media type things that are
Mhm.
surrounding it yet. The only complaint I get from clients is their dog is on it for, they say the first 2 doses were
Yeah.
great and now they're back to the same they were. And
Mm-hmm.
I don't want to keep spending the money. Can we switch back to the Rimadyl because it was working better? Like, those are the only discussions
Sure.
I have surrounding it.
Yeah.
Yeah.
But otherwise, my patients do great on it.
Yeah, I always encourage people to go ahead and stop it and then see.
That's what we do.
And then a lot of times they call back and they're like, yeah, well, okay.
He's worse. It was working.
Exactly, he
Yeah.
was better. I just
Yeah.
didn't realize that.
Yeah.
Yeah,
So
that's
those
so
are
funny.
the only conversations pretty much I've had about
Yeah.
It's not like you have to like build up. Like it's just a monthly injection, so you can just start back up whenever.
Right.
Mm-hmm.
Yeah. What about, do you remember when Saperica went through that whole,
Oh my gosh.
the ringer with all the,
I've gotten my fair share of Simparica seizure questions.
yeah. And that was another one where they relabeled, and Zoetis is going to add to their package insert the information about,
Ataxia.
Yeah,
seizures,
exactly, in there, because
neurologic.
their goal is that veterinarians have the best information to make the best decisions on behalf of their patients. So they really want veterinarians to know all the information so they can make the best decisions. That's the whole point in adding it to the package insert.
Mm-hmm.
So they'll do that. They're going to do that. They're in the process of doing that. But that's what they did with Simparica.
Yeah.
Like the isoxazolines, they did that for a lot of them.
Mhm.
They made them add that to their
Yep.
package insert label.
I still have people who won't use Simparica.
Yeah.
Yeah.
But you do you.
You do. Yeah, exactly. And you have to be
your
comfortable
pet.
with the
Yeah.
risk benefit
Yeah.
stuff.
We can tell them the information. If they still choose not to, that's on them.
Absolutely.
But we do our part.
All right, I'm off
Okay.
my soapbox now.
That was a really good
Inquiries.
soapbox.
Oh, thanks.
That was
Courtney.
good information.
That was okay. First one. Howdy. I have 2 questions. One is personal and one is general. Number 1, what are the most common cases you tend to see around Thanksgiving, and are they any different from your usual common cases? Number 2, I have a approximately 3-year-old neutered domestic shorthair who was originally found outside in Tennessee as a kitten. He has some scarring on his eyes that vets agree is likely due to an early feline herpes infection. Other than that, he is perfectly healthy. Recently, he seems to be having a reaction to his flea preventative, He Gets Revolution. It has not been consistent, but about half the time within the past 6 months, he has developed a bald spot or scabbing between his shoulder blades where I put the preventative. I'm not sure if it's him scratching or over-grooming at the spot or if it's caused by the preventative. Have you ever seen a reaction like this before? Any suggestions for getting cats to leave their preventative alone? When I spoke to my vet about it at his annual visit in October, it had only happened twice and she said to just keep an eye on it, but it wasn't an issue she had heard of Revolution causing. Thanks so much. Love the podcast. From Hope in Wisconsin. P.S. I'm not sure if I'm able to send photos, but I tried to send one photo of his eyes and one photo of his most recent bald spot. His name is Rook.
I like his name.
Hope. I almost just said Hook.
Rook
and Hook.
Rook and Hook, yeah.
Thank you for the
Gosh.
question.
Yes,
That's a
thank
good
you,
one.
Hope,
Do
for
you
your
wanna-
question.
Do we want to touch on Thanksgiving first?
Yes.
Sure. Go for it.
Colitis?
Pancreatitis.
foreign.
Yeah.
I mean, foreign bodies, but
I mean,
like,
you could.
I think pancreatitis is
Like
more
on the
common.
bones or something.
Yeah. Yeah.
Like I feel like
We're
there's
just getting into
sometimes
the trash
holiday
because
like
Yeah.
trying to get
this
to the.
Thanksgiving didn't seem that intense to me.
Yeah, it really didn't.
Yeah.
Like we didn't have anything out of the ordinary.
Yeah.
No.
We didn't have like any hospitalized patients.
I mean,
really.
we always have pancreatitis and like
Yeah.
dogs that ate something they shouldn't have, or they.
I mean, we prepare for the worst after a holiday, of course.
Yeah.
but I wouldn't say that they're any different from our common cases.
Maybe just more.
Yeah.
An influx.
Yeah.
of
Yeah, I would
things
say
we
like
see.
if dogs boarding, like maybe there's some stress around that.
Oh, sure.
Like where
Yeah.
we might
Stress
see some-
colitis.
Yeah, stress colitis, like you mentioned, Devon colitis, and then maybe upper respiratory stuff if it's going around
Yeah.
at that time.
On the kennels. Yeah, that's a good point.
What else?
Nail trims.
Yeah, because they got to get their dogs looking good for
They
family.
gotta looking good. They gotta be looking
'Cause there's
good.
people
We got
coming
a
into-
lot of
I had
nail
a
trims
client
before
multiple say
Thanksgiving
that
this
to
year.
me. They were like, "We have people coming over. We got to get our dogs."
Oh,
fixed."
absolutely.
Go to the group.
Well, because they're probably gonna jump up on people and scratch them, and
Oh my god, that's hilarious.
Yeah, I don't know. Or we had a lot of people calling for drugs because dogs have anxiety when
yes.
people come into their house.
Yes, so that's probably another thing that we
A lot of
talk
dispensing
more about.
trazodone. Trazodone for everybody.
Yeah, trazodone for everybody. Money, trazodone, trazodone.
Felt like Oprah
Oh
or
my
Ellen giving
God.
away stuff.
Give it away.
I think that's about it.
Yeah.
I think so.
Yeah. I think that sounds about right.
Mhm.
I feel like we've seen a lot of dog fights recently, but I don't think that has anything to do with Thanksgiving.
Well, it could be with people coming to each other's houses, like bringing company,
Oh,
and they bring their dog because they think that's a
That could
good
be-
idea.
yeah.
And, so,
I know. Like
and the
they,
dogs
and
get
then
to
the
fight.
dog, yeah,
It's a
and then
family
they fight
affair.
over
It's
some turkey.
Yeah,
I think it's funny when people just like bring their dogs to functions thinking that they'll be best friends.
Yeah.
It's not like humans.
No,
It doesn't even work that way in humans.
doesn't.
yeah. I will say I
Yes.
took my dog to my Thanksgiving and my Friendsgiving, but he did fine. They already met.
Well,
but,
they'd met.
Ugh.
but yeah,
Yeah.
good times.
Okay.
Okay.
Number 2, have we ever
Revolution.
seen revolution causing the irritation and baldness?
I sure have seen revolution called
I
bald,
have,
cause a bald
also.
spot. It doesn't look irritated or inflamed. It just
No.
ends up being a bald
Yeah.
spot.
It gets inflamed if the cat is irritating it.
I'd be
But
surprised
it really
if the cat
shouldn't
can groom
because of
that
where you
spot.
place it.
Yeah,
Yeah.
right.
So you shouldn't have to cover the revolution with anything. You shouldn't have to. It's
Put
a
it higher
small
on the
amount.
neck if you're not putting it high
Right.
enough.
Like right at the base of the neck,
Yeah,
so
part
they
the
cannot
Cs.
turn around. They cannot scratch it.
Mhm.
Yeah.
But typically it resolves on its own. And I was also told like you can take a capsule of vitamin E and rub it into that spot
Like after or before?
once it's dried. Yeah, like once you see the bald spot, which is not going to happen immediately. It
Yeah.
takes
Yeah.
several days. I think there's something.
I mean, it does smell pretty pungent, so I'm not
It
surprised.
smells
that
like people say it smells like celery.
I
Do
think
you
it
guys
smells
agree?
like.
Revolution?
I think it smells like
I've never smelled it.
marijuana.
Oh, you do?
I do.
Yeah.
Every time I open the package before I even pop it,
Yeah.
I think it smells.
I don't
like
apply
weed.
it enough to. I don't have a cat,
Yeah. Yeah.
but when I've
used it.
applied it
It's
in the clinic,
strong.
I've never noticed it. Now I want to go smell it.
Yeah.
You can come smell mine. Come sniff my Revolution Plus.
But if my question was like, if it's not happening consistently, do we really think it's from the revolution, or can it just happen like on one off and then?
Do you think it happens more like if they put it more so on the fur versus the skin?
No.
You don't think
I mean,
so?
I don't think. I mean, you have to get it on the skin for it to affect
Yeah.
the follicles. I'm
Yeah.
sure.
But like she is saying, it doesn't happen every time. So like, is it truly the revolution? But
That's what I'm saying. Like maybe sometimes she accidentally gets
Maybe
it
it
more so
doesn't
on
get
the
as
fur.
much. Like
Yeah.
maybe the concentrate. Like
Yeah.
maybe the amount in one area.
Or like they shake it off.
Yeah.
I don't know.
Yeah. I wouldn't put like a surgery suit or anything else like that on it because
it's just gonna absorb into
right,
that.
and then you won't have effective.
Maybe try.
preventive
I
control.
tried to like distract my cat right after I put it on, like with treats, so he doesn't shake it off right
Mhm.
away. Let it absorb a little bit more, but
Yeah, definitely Make sure you part
Just
the
make
hair
sure
really
you're applying
well.
it in the right spot.
mhm.
Yeah, and apply it in the right spot.
Because
The
I
right
mean,
dose.
if it's really far down, he could be licking it off. And
There's
then that's,
probably a more sophisticated cause, like I
Yeah.
mean, reason for it to be happening, and I feel like it's something. I feel like I've asked Sarah Pate this before. It's something with the follicles, and I can't remember what it is.
That's okay.
So, but yes, I have heard
Yeah.
of that. It's I don't see it very often at all,
Yeah.
but
Mhm.
and it's not anything that's harmful per se.
right.
He needs a comb over,
Prevention and a little bald spot's better than fleas and ticks on your cat
absolutely, and heartworm disease
Mhm.
and
Yeah.
heartworm disease. Because that is fatal.
His eyes, yes, that is definitely probably the most likely cause
Yeah.
for his eyes having that on there for sure.
He was
Yeah.
found in Tennessee.
I know.
I want to see a picture of him, Brooke.
Hey, Weston, did we get the pictures? Good talk.
Okay, he's not listening to us. All right.
Anyway,
Nothing new.
second one. Can we do it?
Sure.
Okay. Hello, my name is Emma. I'm a tech student from upstate New York. I'm attending BMX for the first time this year, and I'm wondering if you have any tips for making the most of the conference and making connections.
Come find us. Okay, sorry. Just kidding.
We're the directors of the conference. The schedule at first glance is a bit overwhelming, I would agree. And I want to make sure I'm taking advantage of every aspect. Any tips are helpful, including dress code, etiquette, note-taking, etc. I will be going to the BRT live show with my friends and look forward to meeting all of you in person. Thank you for everything you do. Again, from Emma. We are so excited to meet you and your friends.
Oh.
That's so fun.
That's so exciting.
Okay, you guys have been on the app.
Yes. Oh, download the
So-
NAVC app, NAVC app, and then you put your events that you're going to, and it'll pop up VMX, and it has like a whole dashboard of everything. It
Like
has
all
like
the lectures.
And that's what's
lectures.
overwhelming, right? Don't
Yeah.
you think
Yes.
that that's
'Cause
like
there's-
so
it has
much?
the
There's like
lecture-
5 lectures at every hour.
Yeah, but it's like broken down by day. But then it also has like special events that are happening, attendees. Like
There's a lot
it
of
has
options.
the whole like just go on the app,
Lots of options.
and then you can pick what like conference or what talks you're interested in, and then you can star them, and then they're just there.
Yes.
But there's a lot to go through, so like don't do it the day of
Mhm.
because it's a lot. Like they
Yes.
start at 6 a.m.
Yeah, it's a
So
lot.
5 a.m. I saw
5
a
a.m.
5 a.m. one.
Sorry, 5 a.m.
To go like tour a manatee thing.
Yeah.
So I would say, as far as note taking, you can get you can download the, like they'll give you all the proceedings.
Ah.
You know, so I would do that because it'd be a lot easier. Or, I mean, you could in theory sit there in a hall and type it all
Yeah, I mean,
up.
You
They-
could take
they-
your iPad.
People
You
would
take your
know
iPad
that
and
you're
do that. You
taking
know,
notes.
Or
Yeah.
I know they give away a lot of free stuff. They're probably giving away notebooks somewhere at the conference.
Oh yeah,
Or
I'm
bring in
sure.
a little notebook.
Yeah.
But really, the online proceedings are great. You could take pictures
I don't
of
know if you'd be able to
slides
bring
a
in
lot
a
of
computer.
times. You know, when
Darn.
when the people are giving presentations and
Yep.
there's like a cool, like, you know, graph or diagram or
Mhm.
something, you could take a picture of
Yeah,
it.
for sure.
Yeah.
But definitely the online proceedings are really cool. So
Yeah.
that's a really cool thing. Dress code is typically business casual,
Jeans and a
like
t-shirt.
yeah, to the low end, you know.
Mhm.
So you know, there's a lot of people that'll dress nicer than that, but then
Mm-hmm.
you know, and it's Florida, so depending, like, so people are probably gonna be wearing mostly pants, even
I
though
think
it's
it's supposed to
60
be like
degrees.
a high of 60 and with the
Yeah.
drizzle.
Yeah.
So there'll be, you know, some people wearing
I
shorts.
mean,
but,
don't look like a bum, but I think that
Yeah.
goes for everywhere you go.
yeah. Etiquette. It's a definite must that if you see us, you run up and say,
For real. Be obnoxious.
no. Etiquette is just, I mean, really
respectful.
Just respectful.
yeah,
Yeah.
be respectful. Make sure you definitely go to the exhibit hall. And it's pretty self-explanatory when you get to the exhibit hall. It's all set up based on numbers and booths, and you can just walk your way and wind your way through.
Mm-hmm.
There's you know, I always try and have respect for the people in the booth because that must be a really hard job
Yeah. No.
to talk to people all day long, but then
And say the same thing over and over
and
again.
to get them to listen about whatever it is you're talking
Yeah.
about or selling.
Mhm.
So I try and always be respectful, so much to the point that last time I was at a conference, I ended up coming away with something that I totally should not have bought. And Harrison's like, "Why did you do that?" I was like, "Because she worked really hard to sell that, so I bought it."
Oh, gosh.
And he's like, "Can I have it?" And I was like, "Okay, you can take it home with you." It was one of those like Theraguns. And she's like,
Oh.
"Here, let me try this on you." And I was like, "Okay." And then and she kept talking, and I was like, she was doing a really
Are
good
you falling
job.
asleep?
And so then
You
I
could
was
use
like,
it now for your back.
I know, right?
That's
So
funny.
I mean, you know, just being respectful of those people's time
Yes.
and like their efforts and things like that.
Yeah.
Mhm.
Obviously, in the halls while you're listening to the lectures, being respectful of the people talking.
Mm-hmm.
Turn your ringer off.
Yeah, you know,
No
they go
flash
through a
photography.
lot of that stuff as well.
Yeah.
There's really cool places in the conferences to make connections, and even through the app, you can find people
Yes.
to be able to make connections. So that's really cool. You already know people that are coming, so you have that advantage. But if there was somebody you wanted to find, you know, or
Can we,
see if
like,
they're there,
Put a location as like we're at like the vert group's at a certain booth.
Oh yeah,
and you can
do
like
that.
look up our group, and
We probably can do that.
Go follow our social
That'd be
medias,
cool.
and we might put it on our like Instagram stories.
We'll
Like,
have to be in
hey, we're gonna
live.
be here for 15 minutes.
Yeah.
Come say hi.
Yeah.
Yeah.
Then we're relocating. Come find us. It'll be like hide and seek.
Yeah. Yeah. Exactly.
When we're in
exactly.
our red, we'll be easy to find
Yeah.
on Monday. If
We
we
may
go.
not be in our red though, but if you
Yeah.
see us separated, you can still come say hi. You don't have
For
to
sure.
say hi. We all will not be together the entire time,
Right.
and we will not be wearing red the whole time. But come say hi to us if you
Please
see
do.
us, regardless.
Be a little
Absolutely.
gaggle.
And we're down for a picture.
I would say also go to the concert on Saturday night
Oh yes, Dan and Shay,
because that will be worth it. Any of the concerts I've been to are always fantastic.
take all the free stuff you can.
So yeah,
Mhm.
I mean, definitely
Leave
go to the
room in your
concert.
suitcase to pack it back.
That's a good tip.
Yeah.
Conferences give
true.
away free stuff.
Yeah,
all
they
the
give you
time.
lots of stuff.
Yeah.
So make sure you have room to take stuff home.
Mm-hmm.
They'll give you like bags or backpacks or something, you know what
Yeah.
I mean, to put it all in, but then you got to put that somewhere.
Right.
So I guess you could use that as a carry-on, but
Yeah.
Mm-hmm.
but really just enjoy, make connections.
We look
Mhm.
forward to meeting you.
Yeah.
Yes.
You know,
the live show is going to be a good time.
It's in
I'm
less than a
excited.
week. We'll see you in less than a week.
Absolutely.
I know. I'm so excited. Okay. King, take away the next one.
Okay, you all are crushing it. I really look forward to every new episode. See you soon in Orlando. Fellow podcaster, It Might Get Weird, and AVMA Vice President Gary Marshall.
That's so cool.
That's cool. Thank you,
That
Gary.
is cool.
Super
Thank
nice
you.
guy. If you have a chance to meet him, Emma, you should definitely meet him. He's a very nice gentleman.
Thank you for supporting our
thank you so much
podcast,
for the
Yes,
review.
thanks, Gary.
That's so
fellow
sweet.
podcaster.
Absolutely.
That's very cool.
Okay, don't forget about that text message feature for our podcast. You tap on an episode in whatever podcast provider you prefer, and then you look at the top and it will say send us an inquiry through a text message here, and you can text us if you would like a shout out or to be mentioned on the podcast episode. You do have to leave your name, otherwise it comes through as anonymous.
Okay, case
Okay.
collections.
Oh sure.
I can go first.
Oh okay.
Or unless you want to.
I don't care.
Is yours long?
No.
Okay, you can go.
Okay.
Let me get my papers in order.
Okay. All right, T. So we had a 8-year-old male neutered labradoodle come in for an assessment of a wound on his ear. It was his right ear. The wound had been present for about 2 weeks. It seemed like it was healing, but then started bleeding again. Not sure what the cause is. He was not bothered by it, not scratching at it, but they just wanted it checked out because they noticed the bleeding. So there was just a small like scab on like the caudal aspect of the right pinna. So it was kind of like on the tip of like if they were to like shake their head and bust it open, it's like the tip of the pinna. So we clipped and cleaned it. The scab was removed to just notice that it was just an open puncture wound. It didn't look necessarily like infected or anything like that. We just assumed it was like irritation from his haircut, so the groomer. So all we did was do Animax. We did that like 2 to 3 times a day for a week, and then just told the owner to monitor and whatnot. So a few weeks passed by. I think it was like 2.5 weeks. The owner reaches back out and asked to schedule a progress exam because she wanted a reassessment of the same ear. So the same pinna. So she had stated that the swelling had healed completely within a few days of us seeing him at the initial appointment. But then 2 weeks later, the owner noticed fluid-like lump at the site, which was not bleeding at the time. But then, so this happened on a weekend. So then by Monday, the lump had started bleeding profusely. He still was not scratching at the area or bothered by it whatsoever. She was still doing the Animax, things like that. He wasn't showing any kind of discomfort, blah, blah, blah. So we go to examine the ear again, and there is a sub-Q mass at the base of the right pinna now. So it's like in a different spot. So it's literally at the base, which is a horrible spot. So it was ulcerated, and had some purulent material / like drainage coming out of it. We did end up FNAing it, and it revealed numerous mast cells.
Oh, jeez.
So the cut was at like the bottom of his ear the first time, and Duckwall did the exam and was like, this tissue like feels weird, like at the base of the ear, but she's like, I can't convince myself it's a mass. Like it doesn't feel right. Like she
Right.
said that to herself in her head. She didn't say anything to the owner at the time because she's like, meh. And then he came back, and I mean, it was a very clear mass.
Mm-hmm.
So we poked it. It was a mast cell. We did actually end up removing it And he is doing very well. It's healing well. I mean, it's a bad spot, but he's healing really well. He has a no-flap ear wrap on.
Oh,
But he's doing good.
cool.
So it's just funny how like two things happened at the same year, like, and they were like completely unrelated.
Yeah,
It's weird.
very weird.
You guys have had a lot of surgery lately.
That's a dog for you. Goodness gracious.
Yeah, I don't want to talk
How does
about
that make you feel?
I know, right?
I'm not having a good time.
And you have another one tomorrow?
Two more
Stretching
tomorrow.
you, stretching you, just a
It's
little.
just all like we just
Like you haven't had a surgery for months. I feel like.
right. And I've
Yeah.
had one like every day for the past 2 weeks.
crazy.
But they're all mast cells. Like Dudley, Whitney, and I were talking about it, and we're like, "Is there something causing mast cell tumors?" Because that's all Dudley's
Something's in
diagnosing
the
too.
air.
Like they're just on a rampage right now.
Yeah.
Everybody's got mast cells.
Everybody's got
So
a mast
Miles
cell.
gets checked on a daily basis.
Well, it's probably not a bad thing.
He's got blue pity in it somewhere, so it's fine.
Yep,
that's it.
exactly.
Okay. My case is a 10-and-a-half-year-old male neutered Italian Greyhound. He presented a couple of weeks ago for a mass on his left carpal joint. They said that it had been there about 8 months and it had just slowly been growing, and they finally brought him in for it because it was starting to impair his mobility. So we did an FNA, and the FNA revealed hemodilution with clumps of suspected mesenchymal. Did I say that right?
Mhm.
It's
Cells.
Mesenchymal.
a famous motto.
That's how I say it, but yeah.
There was concern for a soft tissue sarcoma. And
Ew.
just for some like size reference, he is an Italian Greyhound, so he's very small, but the lump was about 1 by 2 inches.
Yeah.
So we just did the FNA and recommended either biopsy or mass removal since it was still so small. So we sent them home for them to discuss and get back to us. Well, they came back 2 weeks later and it had grown significantly. And now his entire leg was much fatter than it was, and even compared to the front right, it was like twice the size. But when you felt it, it wasn't very swollen. It kind of felt like the mass had spread up. So we took an x-ray, and the x-ray is cool because you see the mass and then you see like the soft tissue structure that goes up to about the elbow. So at this point, we're like, okay, we cannot remove this mass and get margins. So we recommend amputation. So of course that was a lot to digest. The owners talked about it, and we ended up amputating his front limb yesterday.
How did it go?
It went really well. It was Hannah's first 4-limb amputation.
Yeah.
I'm so proud of her. She says she felt really good about it, and we sent the limb out. So it'll be interesting to see what it comes back as, but it's most likely soft tissue sarcoma, but nerve sheath tumor is also a differential.
Yeah.
But he came in so we could look at the incision today, and it looks beautiful. The bandage was like completely dry, no leakage.
Yeah.
And then we put him on the ground and had him take his first few steps. He did so well. He almost ate the floor a few times, but he never actually hit his head.
That's good.
So he's getting there. And he's eating. He's
Yeah. Front limb
using the
amputations are
bathroom, so-
great.
Dogs don't even.
but he was
like,
10-and-a-half years old. Like
Yeah.
dogs blow my mind.
so
Like, just imagine going to sleep, waking up, and you're one limb down.
Yeah.
But like they handle it so well.
They really do.
They just get up and mosey about themselves
especially
like nothing
when
happened.
like he was already limping on it.
Yeah.
So it's not like it was 100%, you
Yeah.
know.
I feel like most animals I've seen, they just handle amputations so well.
Yeah. Well, and you remove the primary source of pain for a lot of them.
Right.
You know, so yeah, they have post-surgical pain, but they don't have that chronic
Achy.
pain,
Mhm.
you know, that's going to get worse and worse and
Mhm.
worse. And so, I mean, sometimes it's palliative therapy, sometimes it's curative, but
Yeah.
they really do well. And like we were talking about, that's really interesting. 4-limb amputations are interesting because the only things holding that leg on the body are muscles.
Mm-hmm.
So like it's just an effort in dissection,
Mhm.
and you just take your time.
She
and
used the cautery. She liked
Oh,
it.
good.
I was not
Yeah.
prepared for them to take like a massive metal spatula and literally squirt lube all over it and then just stick
Slide
it underneath
him. Yeah.
Oh,
Well, because you need a grounding. Yeah.
I
Yeah.
haven't used it yet.
Yeah, I
Yeah.
turned around and Allie had like literally, I'm not even kidding you, like this size
Like a
metal
spatula.
and it was just lubed up. And then she goes,
Yeah. Put it
and
underneath
I'm like,
them.
oh,
Yeah.
okay.
Yeah.
Yeah, I haven't used it yet. Duckwan, I should have used it probably multiple times by now, but we
Yeah.
haven't used it.
Yeah. You
I
should
will
encourage
say-
her tomorrow.
I was
Mhm.
talking to Ashton, and Ashton says that every time she's used it, she's noticed elevated blood pressure, but like all of the other vitals are stable. So she was like playing with all the things. So just a heads up. If
Interesting.
you use it, you
I
might
don't
notice
think
a-
the mass tomorrow is big enough to use, and we're doing a neuter gastropexy, so like
yeah.
We don't need
Oh,
her
that's
for that.
right. She told me about that. Yeah,
But-
gastropexy.
But
Well,
yeah.
that's cool. That's a cool case too.
Yeah.
Well, it'll be interesting to see what the
Mhm.
final diagnosis is.
Yeah, Gracie Lou really could have used that cautery.
Yeah.
Maybe that would have avoided the surgery at
Well,
6
I think
p.m.
it's a new.
But yeah, we
thing,
just weren't
so-
thinking about
yeah.
it. And she was already like knee deep, and she's like, ah.
Yes.
It's fine.
exactly.
Everybody's fine.
Everybody's fine.
and it
That's
looks
right.
really great.
Yeah.
Okay, listener question. Hey everyone, I am finally achieving my lifelong dream of becoming a vet. Congratulations. I just got accepted into the DVM course at the University of Melbourne in Australia. 8-year-old me is proud. I just wanted to say I've absolutely loved watching The Vert and it has been amazing to get a look at the industry. I had a question though. How do you deal with the knowledge that you can save an animal's life but you have to opt for euthanasia due to financial difficulty on behalf of the client? Keep up the good work, guys, and hopefully you can come down to Melbourne. We're better than Sydney Uni. From Alex.
Now we get 2 places to go.
Is it Melbourne or Melbourne? I said
I don't know how to say
I said
it.
it differently.
I say
Melbourne.
Melbourne.
I think in Melbourne.
Melbourne. I don't know. Put
And-
the accent on and then see.
So we're gonna have to go 2 different places now
I'm not going to do that.
in Australia. That's amazing. We've got 2 places to go.
That's amazing. We'll make it there.
Okay,
Well,
Alex.
congratulations. That's
Yes,
so exciting.
congratulations.
Yes.
That is absolutely amazing, and you should feel really
You're
proud
gonna
about
kill
that.
it as a vet. Oh, that's not the right words to say.
Right.
You're gonna do great.
Oh gosh.
Anyway.
Okay. How do you deal with the knowledge that you can save an animal's life but have to opt for euthanasia due to financial difficulty? This is a really great question.
It's a very hard pill to swallow and a very difficult way to look at things. But one thing that I try to tell myself, rather than getting angry at the client and saying that they don't care about their pet, is like they're trying their best.
Yeah, like they're probably
And
just as
the
devastated.
animal is not suffering from whatever disease or illness it has. Like rather than the owner just taking it home and nothing's happening, you know? Like if you do have to euthanize,
Yeah.
Yeah.
it's not suffering.
Yeah. I think the definition of save an animal's life, are we talking about curing an animal or like managing an animal?
Right.
So like that's like the fork in the road for me as far as like trying to in terms of how I'm going to involve myself in solving the problem. So if I have a situation where the owner can't financially manage a patient, but it's an incurable thing,
Diabetes.
yes, for example,
Mhm.
I don't know what the right word is. I'm not as bothered. I don't know what the right word is.
Sure.
For in that situation, because the animal has something. Yes, it could be treated. Is it curable? No. You have an animal that has a foreign body and it's curable. You have a patient that has a fracture and it's curable. You have
True.
a patient that
Yeah.
has, so you know,
Yeah.
and you're going to euthanize those patients. That's typically where I intervene. So in those situations, I'm going to either I'm going to go through all the questions that you were talking to the owner about in the last podcast about, do you have somebody that can help you financially? Do you have somebody that can take the pet for you? Do you have blah, blah, blah? If the answer to all that is no, then I'm going to ask, and I've exhausted care credit as an option. Then I'm going to ask if they mind relinquishing the pet. So can I have the pet? Like, can the clinic own the pet? And then we'll find it a home.
Mhm.
So we've done that before.
Mhm.
Or depending on the situation, we'll do stuff for pro bono.
Yeah.
So like,
Yep.
Are we going to fix this and then do it at a much reduced rate such that the owner can contribute financially, but yet maybe not at the level that normally you would be asking
Sure.
them to.
Yep.
So we've done all of those things to
Yep.
address that particular problem.
Yeah.
And then I would say if it's something that you're really passionate about, then you can form a foundation, which is where you have your clinic has a foundation and your community can contribute to it.
Yep.
And then you can provide care for pets who can't.
Yep.
And then you would have guidelines around that foundation. Like, we're going to use it for only curable diseases. We're going to only use it for blah,
Yeah, there need to be
blah, blah,
rules in
blah.
place.
And you would have a little committee that decides, how the money is distributed to what cases and
Yep.
whatnot. But I mean, that's really a good morale booster for staff, and that's how we always looked at it was, yeah, I might be giving away $3,000, but the staff are going to feel really good about the decision we're making. So we're not euthanizing this puppy that has a foreign body. They're going to save it. We're going to work on it. And,
Yeah.
so I think, we're going to use it as a learning experience. So that's another way. If it's something we've never done, we're like, hey, we've never done it. If you don't mind if we do it, but we've never done it, and we'll reduce the rate dramatically for you. It's another way we've done it.
Yep.
To help people.
I was going to say, I have also another thing we've done if an owner can't like afford our fees necessarily. We know like a surrounding hospital who like sets up payment plans because like some clinics just don't offer them. We do not offer payment plans, but we know some that do. So you could also encourage them to take them elsewhere.
Absolutely.
That's an option. Like if it's going to save the pets in whatever means your but
absolutely.
That's an option.
Even going off of what you said, my pit on this episode from last night, the euthanasia, like I would much rather her be euthanized at the very like cusp of her sickness than watch her slowly get sick and not
especially
be managed.
If it's kidney disease, that'll knock you down pretty quickly.
Yeah, absolutely.
But we did have a cat. It has resonated with me, and I think about it frequently. We had a cat. I don't know. I think before I started working at All Star, that it needed a foreign body surgery, so we helped along the lines of pro bono. And then the cat was fine, and then it came back a couple of years later with another foreign body, and they couldn't afford it again. And I wanted the cat so badly. I literally sat in Cat Mountain and held the cat all day and just sobbed because we had offered relinquishing, and I had just lost one of my cats. It was an orange cat. I was like determined to take this cat home, and then they opted to euthanize.
Yeah, and then sometimes you can't.
It was like a 3-year-old cat.
Yeah, I mean, like, because you're not the owner.
Yeah,
the owner's gonna. Yeah, at the end of the day, you can do what you can, but the euthanasia might be the end thing. It just happens.
And I think for some owners, it's easier to euthanize than think about someone else taking care of their cat or their pet that they weren't able to.
Yeah, it's a
and I
short-sighted view, but I see that a lot.
Yeah.
Oh, I've seen it multiple times where we give them all the options. They're like, nope, we just need to. She needs to go. Like,
yeah. So, and it's really important just not to judge people based on their decision making, because the majority of the time we only are privy to partial information. So
it's a hard thing to do, but you got to do it.
Yeah. So, anyway, great question, Alex.
Absolutely.
Yes. Okay.
I think that's it.
Am I taking us out?
Yes.
Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or previous one. And if you're attending VMX, once again, we have officially sold out of the Veterinary Roundtable live tickets, but we are excited to party with all 350 of you at Ole Red. We'll see you next week for another episode of the Veterinary Roundtable.
Woo!